I saw you yesterday, but I didn't see any of the hearing today. My team pulled some great sound bites. Didn't see any of it today because I was with Rubio and then Tulsi. So you've sat through it all. How did today differ from yesterday, and how are you feeling?
Megyn, there's a lot weighing on I think the country right now. We're at a true inflection point for American health. From your first interview with Bobby years ago, putting him on the national scene or really helping with that, to that incredible endorsement with Donald Trump of bringing millions of Maha moms to this coalition that elected him. We are at a fork in the road for American health, and I'll just be really blunt. The takeaway from this hearing is that road goes through Senator Bill Cassidy. Senator Bill Cassidy is a very influential senator. He's a doctor, he's a physician, he's chair of the health committee. And I'll just be blunt, as Bill Cassidy votes, will go the way of Maha and RFK. And I'd love to, if it's okay with you, Megyn, make a direct plea to Senator Cassidy, because I know he cares very much about public health and trust in public health. And I know he is legitimately still considering this vote. And I think everyone needs to focus their attention on him right now. I'd love to make a couple points to him.
Please, go ahead.
So Bill Cassidy, by all accounts, is somebody that, as I said, deeply cares about trust in public health. And I really do believe that the so-called Maha movement, this loose coalition of folks that came together that are really concerned about children's health, and Dr. Cassidy, who's a person who's spent decades working on healthcare and health policy to help patients, I think they're talking past each other. The crux of Dr. Cassidy's deliberation is around trust in public health. And I want to just make a couple points to him as a parent, speaking, I think, trying to channel what brought Bobby Kennedy into popularity and into helping President Trump. The public health crisis and the trust in public health is not because of Bobby Kennedy. Just speaking as a parent, there's anxiety among every single parent in this country. I mean, kids are looking at kids. There's autism rates that are skyrocketing. We don't know why autism is skyrocketing. I'm scared as a parent of a 3-year-old about autism. It's now 1 in 30 in California. The NIH and the public health authorities have not come to a conclusive answer on why autism rates are going through the roof. Kids are subjected to an unending array of environmental toxins and toxins in our food. The FDA, which is fully bought off by the pharma and food industries, 75% of the drug approvals at the FDA are funded by pharma. They said, we don't even know the chemicals in our food. There's 10,000 chemicals in our food that aren't allowed in any other country. And the red dyes and things like this, the FDA still tells us are safe. We're trying to ban one. There are still many other chemicals like that that are totally inappropriate. Kids are walking into a treadmill of drugs. Right now, the American Academy of Pediatrics is saying that the standard of care for a 2-year-old, for a 12-year-old, is Ozempic if they're overweight or obese. And they're studying for as low as 6. The health authorities are saying that if a kid is sad, they need an SSRI. SSRI rates have doubled in prescription rates among teens in the last 5 years. They're saying if they have high cholesterol, it's a statin. Statin rates have doubled in the past 10 years among teens. Metformin, ACE inhibitors, all of these drugs our kids are getting on as they're getting more sick. The standard of care is totally, clearly rigged, where 40% of our teens are on a pharmaceutical product, and there's 4.6 billion pharmaceutical prescriptions written per year that clearly aren't working. And I'll be honest, I'll just be blunt, Megyn, as a parent, I'm concerned about vaccines. We have a different schedule in the United States than other countries. As Bill Cassidy said today, it is not appropriate for a kid to get a hepatitis B vaccine, which is an STD, on the first day of life if the mother tested negative for that condition. That is not the mandate right now. It is a mandate for first day of life. That is the CDC guidance. So what Senator Cassidy said even today contradicts the specific, unambiguous CDC guidance. There are questions to ask all these things. And again, when we come to the issue of trust, I would plead to Senator Cassidy, from knowing Bobby Kennedy, from seeing Bobby Kennedy, I have never, ever heard him say that he wants to get in there and exert his own opinions. He has consistently said, and he believes this to his core, his opinions, even if he has differing personal opinions on certain pharmaceutical products than Senator Cassidy, are meaningless when he gets into the HHS. He and President Trump are strongly, they're hell-bent on restoring trust in science, on getting money to scientists who do not have conflicts of interest and unleashing them to do true scientific inquiry on why we're getting so sick. He means it when he says to Senator Cassidy that he wants to restore trust in science. And the crux of Senator Cassidy's final message and his final question to Bobby Kennedy is, will Bobby Kennedy definitively say unambiguously that vaccines don't cause autism? And Bobby Kennedy wouldn't answer that question directly. I think it's inappropriate.
Wait, stand by, Calley. We have that.
Yeah.
We have that. Let me play it, and then you take it on the back end. Watch.
Does a 70-year-old man, 71-year-old man who spent decades criticizing vaccines and who's financially vested in finding fault with vaccines, can he change his attitudes and approach now that he'll have the most important position influencing vaccine policy in the United States? I recognize, man, if you come out unequivocally, vaccines are safe, it does not cause autism, that would have an incredible impact. That's your power. So what's it going to be? Will it be using the credibility to support lots of articles? Or will it be using credibility to undermine? And I got to figure that out for my vote.
Go ahead, Calley.
Megyn, this is, honestly, it's hitting on one of the most important, I think the most important issue in the country, which is trust in our institutions and trust in science. The way to increase trust in science is not for the HHS secretary to make a religious, basically, opinion, a fully 100% firm opinion, one way or the other. It's for the HHS secretary to say, Senator, we are going to continue to conduct science on every question, particularly the most taboo questions, particularly the questions that we've been told are settled science. How many times do we need to be reminded of the corporate capture of our institutions, the breakdown institutions? Is it that controversial to say that vaccines can be one of the greatest inventions in American history, but also the fact that the two largest vaccine makers, GlaxoSmithKline and Merck, have settled billions of dollars of criminal penalties in the past 5 years, and their findings should be continually subjected to science, that in order to gain trust in public health, we need to be able to ask questions and have continued trust in science? This is the key question. It is inappropriate for, and against, frankly, Bobby Kennedy's nature, to give a specific opinion. And he's not coming in to HHS with opinions. He's coming into HHS to set a process where the metric of success is that, according to Gallup polls and other polls, Americans trust science more. Americans trust vaccines more. The absolute implosion of public trust in public health is not because of Bobby Kennedy. It's because of the public health authorities themselves. And I think Bill Cassidy understands and knows that.
Could I just say that, because I had a very visceral reaction to that soundbite. That's the first I've heard that. And I really feel like, how dare he try to extract that statement from RFKJ? I mean, there are millions of Americans who either are personally or their children have been vaccine injured based on different vaccine experiences. It doesn't mean the vaccine's always unsafe. It does depend on the person sometimes. But how dare he try to get him to say out loud, vaccines are safe. And I favor vaccine. Well, like, which vaccines? The COVID vaccine? Because I can tell you, I, along with a lot of other Americans, have had very negative experiences with that. And I would be outraged if I heard him issue such a sweeping declaration. I mean, as you well know, is it safe for a 15-year-old boy who, might have a heart murmur, Senator Cassidy? Why should RFKJ say it is? Kids could get killed. Like, that's a crazy thing he tried to get him to say at the end there. And I'm glad RFKJ won't do it.
Yeah, the reason there's low trust in public health is because we've infantilized the American people. We've made something like vaccines a religious issue where you can't ask questions, where it's either or, it's binary. When there's 72 shots, there's different formulations to each of those shots. I mean, these are questions we should be able to ask. I think it's much wider than that, Megyn. I think what I'd really stress to Senator Cassidy is that the lack of trust is warranted and pervades the entire system. Clearly, the American Medical Association codes, which underlie our entire healthcare logic, are totally broken. I mean, right now, the science, according to the American Medical Association, which underlies Medicare and Medicaid, is that a 2-year-old can undergo gender transition surgery and gender affirming care. That is the stated medical scientific consensus in the documents that underlie American insurance reimbursement. That should continue to be questioned. This is the judgment. This is the judgment, right? I mean, it shouldn't continue to be questioned. It should be immediately called out as an absolute sin and an absolute crime against humanity. But that's the judgment of the science right now.
We continue to face uncertainty when it comes to the economy, with a perfect storm brewing as Social Security and Medicare hit a breaking point as the largest generation is hitting retirement. A smaller workforce means a smaller tax base. You pair that with our growing national debt and the rising cost of living, and we could have a very big problem on our hands. So what are you doing right now to protect your family for the future? Gold can be a very safe haven in very hard economic times, and Birch Gold makes it easy to diversify a portion of your savings into physical gold. Birch Gold will help you transition an existing IRA or 401k in whole or in part into an IRA in gold, and it won't cost you one penny, not one, out of pocket. Protect your future today. Text MK to 989898 and get your free info kit on gold and a copy of The Ultimate Guide for Gold in the Trump Era with a foreword by Donald Trump Jr. There's no obligation, just information. Birch Gold has earned the trust of countless Americans looking to safeguard their savings. Text my initials, MK, to the number 989898 today. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.